Hi, welcome to The Basics with Dr. Mo. I'm your host, Dr. Mo. We're talking about sexually transmitted infections again. Because what I've seen is that people have their eyes wide shut. When I asked what are the symptoms of sexually transmitted infections, here's what you told me.
I think like sores, like in your mouth, on your skin, like sometimes your immune system shuts down depending on what like disease it is. I think that's all I know.
Well, sometimes there's no symptoms at all, but sometimes it could be, itchiness, or it could be burning sensations. It could be basically what sometimes feels like a yeast infection, but it's not a yeast infection.
There's things that are visible, then there's maybe like feelings that you get internally, nauseous, or I don't know.
I'm not quite sure.
I imagine immediate discomfort in your genital area. I think feeling hormonally out of balance.
I'm guessing rash. I'm not sure.
So some of them can have no symptoms, or for females there can be a foul smell coming from your vagina, colored discharge, warts, lumps and bumps. You just don't want to see any of that.
I probably really couldn't tell you.
Yes and no. I mean, everyone gets an A+ in my class. But what if I told you that the main symptoms of sexually transmitted infections are no symptoms at all?
That's horrible. That's bad.
I wouldn't be surprised. I wouldn't be surprised.
That's really scary. I did hear that once. Like,
that's scary because then you don't even know.
So how do they know? What happened? Oh my.
Yeah, it sucks. According to the Centers for Disease Control and Prevention, the CDC, the top 5 sexually transmitted infections among women aged 15 to 24, in order of popularity, are human papillomavirus, HPV, chlamydia, trichomoniasis, also called trich, genital herpes, and gonorrhea. For 4 of these STIs, there are usually no symptoms at all. Only genital herpes has symptoms that include a cluster of blistery sores, usually in the genital or anal area. But even genital herpes may show no symptoms for years. What's a gal to do?
Just regular checkups.
You need to be checking up on yourself regularly and making sure that you're okay, going to the doctor, knowing your body and knowing yourself.
if you have something and it's treatable, then continue getting that treatment. And if you don't, then just keep preventing it, I guess. Yeah.
The first signs, once it starts burning to pee, go somewhere.
Just get tested every 6 months.
I would hope that, I would be able to have this kind of conversation with my doctor, that my doctor would be more proactive maybe about having that conversation with me, right?
I don't know. I would go get tested, but it's a matter of fact, like, when do I do it? I can't just go after each time I have sex, I go to a doctor.
I feel that every woman, every man and woman should get tested whenever they have a new partner.
Yes to sex means yes to testing. The surest way to know if you have a sexually transmitted infection is to get tested. Check out the website, yesmeanstest.org. How often should you get tested? The CDC recommends annual tests for chlamydia and gonorrhea for women under 25. As long as you're at the doctor's office, you should ask for a trichomoniasis test too. Only people with symptoms are recommended to get tested for herpes. The best news of all is that there is a vaccine to prevent HPV, a sexually transmitted infection that can cause cancer. You can get the vaccine anytime before you turn 26. Think about it. As always, I want to give a huge thank you to all of the women who share their stories. We couldn't do this without you. Don't forget to subscribe, follow, and share The Basics with Dr. Mo, because you deserve to know. Thanks for watching.
Sex.